You know, thinking about going to the dentist, it's something we all do, right? It's essential.
Definitely. Part of life.
But have you ever thought about what goes on, like, behind the scenes in those clinics?
Mhm.
Sometimes it feels like there are little hiccups, maybe a bit of waiting, and you wonder, could this be running, more smoothly?
Yeah, there's this whole operational side to providing that essential care.
Exactly. And today we're going to take a deep dive into that side of things, see what we can learn.
That's right. We often focus just on the clinical skills, the dentistry itself.
Of course.
But the efficiency of the operations backing that up, it has a huge impact.
On the clinic, sure, but also on us, right, as patients.
Absolutely. On your experience receiving that care.
We've got some really fascinating insights today, actually. They come from an interview with Kevin Lee.
Ah, yes, the Group COO. Loads of experience in dental.
He ran and advised multiple dental chains, and what's interesting is his background. It's in finance.
Which is a great perspective.
Mhm.
Applying that financial lens to healthcare operations, it can really show you things.
Things you might miss just looking at the clinical side. Efficiencies, inefficiencies.
Precisely. It gives you a different angle.
So for this deep dive, our mission, if you will, is to unpack Kevin's expertise, pull out those key insights.
Figure out how dental practices can really improve their operations.
Exactly. And here's the thing. Even if you're not in dentistry, I reckon you'll find some surprisingly valuable takeaway.
Oh, for sure. About running any business more effectively.
Get ready for some potential aha moments you can maybe apply in your own world.
I agree completely. The core principles, efficiency, smart data analysis, a good team, they're pretty fundamental, wouldn't you say?
Totally universal. Okay, so let's dive right in.
Let's do it.
Kevin talked a lot about growing a clinic chain, and one of the first things he pointed out was just how fragmented the dental and medical landscape is.
Yeah, and competitive too. It's not like some industries with just a few huge players.
Right. Lots of independent practices, smaller groups.
Which makes it even more crucial, for individual clinics to stand out and to operate efficiently if they want to grow.
Makes sense. He also mentioned something interesting about dentists' training.
Yeah.
They spend years honing clinical skills, obviously essential, but there's often a gap in their formal training.
When it comes to the business side, the nuts and bolts.
Exactly. Running and growing a business. I mean, dental school's focused on teeth, right? Not necessarily profit and loss statements.
Precisely. That clinical mastery is the foundation, no doubt. But without a good handle on the financial and operational stuff.
It's tough to build a sustainable practice, one that serves patients well long term.
It can be challenging, yeah. And this is where focusing on specific data, specific performance metrics becomes so vital.
Right. Kevin stressed it's not enough to just look at the big picture for a whole chain.
No, you've got to drill down, see how each individual clinic is doing.
And it's not just what numbers you look at, but really understanding them. What are they telling you? What's the story?
That's a key distinction, isn't it? Having data versus interpreting it.
You could collect tons of info.
But if you don't get the why behind the numbers, what's driving them, what they mean for the business health, and for patient service,
then the data isn't really helping much.
not really providing much value, no.
And that leads to the next really crucial step he mentioned. Figuring out what actions, what behaviors can actually shift those metrics.
Yeah, moving them in the right direction.
It's not enough to just spot a problem in the numbers. You need to know, like, what levers to pull to make things better.
Exactly. Taking insights and turning them into practical day-to-day changes in how the clinic operates.
Which means understanding workflows, patient interactions, resource allocation, all that stuff.
Deeply understanding it.
Kevin also brought up a very real-world challenge. Time. Especially for dentist owners.
Ah, the juggling act.
Yeah. If the owner is also practicing dentistry, they're constantly balancing clinical care with, well, running the whole business.
It's like having two incredibly demanding full-time jobs at once.
Seriously.
And that's a common pressure point. It could definitely impact efficiency.
How so?
Well, clinical duties need intense focus, right? Layering business management on top. Resources get stretched. Inefficiencies can creep in.
Which might affect the patient experience. Appointment times, maybe. Smoothness of the visit.
Could do, yeah. And this is where having the right tools and, importantly, a strong team becomes so important.
To manage things like rent, staffing costs, the big operational pieces.
Exactly, to control those costs effectively.
Which brings us nicely to the consequences of, well, potential inefficiency.
Right, what happens when things aren't running smoothly?
Kevin was pretty clear. When a clinic isn't efficient, it drives up costs. And in healthcare, those costs often end up
Passed on to the patient. Yeah.
Yeah.
That's a really important point for people to understand.
It's not just an internal clinic issue. It can directly impact affordability, accessibility of care.
For everyone in the community.
And it's not just the price tag either, is it? Inefficiencies like, say, long waiting times.
Or feeling like you had unnecessary visits.
Right. That can make the whole experience less appealing, even though it's essential.
And you might think, well, people need dentists, so maybe there's less motivation to improve.
But Kevin pointed out that patient expectations are changing. Definitely.
We're all more discerning consumers now, aren't we? Even with healthcare.
We want convenience, value, a good overall experience.
And if a practice runs inefficiently, disrespects your time. Well, if you have options.
You might go elsewhere. Makes sense.
And the long-term effects for a clinic that doesn't tackle these things, they can be pretty significant.
Kevin listed a few, like suboptimal dentist utilization,
Meaning fewer patients seen per day.
which then leads to lower overall revenue for the clinic,
And a higher cost per doctor operating there.
which, again, can have knock-on effects for the patient eventually.
Yeah, puts a strain on the clinic's financial health. Makes it harder maybe to invest in new tech, better facilities.
Things that benefit patients, exactly.
Yeah.
And it can create this, like, negative cycle.
How so?
Well, if patients are dissatisfied, maybe the work environment gets less pleasant for staff,
Could lead to higher staff turnover.
which means more costs for hiring, training,
A real headache for management.
and ultimately, as Kevin put it, it often translates to higher treatment costs for patients and,
Potentially losing those patients altogether.
it's really a cascade effect, isn't it?
It is.
Yeah.
So addressing those root causes of inefficiency is crucial. For the staff, for the patients, for sustainability.
And Kevin emphasized the first step is identifying those specific pain points.
And keeping a close eye on the right data. Monitoring it.
He even mentioned briefly data analytics and AI.
Ah, the tech angle.
Yeah, how they could potentially streamline things like scheduling, managing patient flow.
That's exciting, isn't it? Using tech to make essential services smoother, more convenient. The ability of AI to analyze huge data sets, find patterns, bottlenecks, things humans might miss just watching day to day.
Could lead to much smarter use of resources, better experience for us when we visit.
Absolutely. Better for everyone involved.
Okay, so shifting gears a bit, Kevin also shared some of his own experience in, successfully running clinics.
Right. What worked for him?
A lot of it came down to something that sounds simple, but maybe isn't always easy. Clear communication and really engaging the whole team.
That human element. It's fascinating, even when we're talking data and efficiency.
Totally. You can have the best systems, the best metrics.
But without a motivated, engaged team, putting it all into practice, it falls flat.
Especially when it comes to patient service.
Definitely. So what did he do?
He made a point of being physically present in the clinics.
Getting out from behind the desk.
Yeah, knowing staff by name. And crucially, explaining the reasoning behind management decisions.
Ah, the why. Not just issuing orders.
Exactly. Bringing everyone on board, showing them how decisions would benefit the clinic, the staff, and, the patient too.
That kind of transparency, making people feel included, that fosters real commitment, doesn't it?
Much stronger sense of ownership, I'd imagine.
When people get the why and feel valued, they're more likely to go the extra mile. For the practice and for the patients.
Makes total sense. If the team sees how their work fits the bigger picture, feels their input matters.
They'll be more proactive, right? Looking for ways to improve things themselves, spotting issues.
Creating that culture of continuous improvement, everyone empowered.
Precisely. Solutions coming from the ground up, benefiting everyone.
Okay, let's circle back to metrics and data, because Kevin was really clear on this.
Fundamental, he said.
Absolutely. Tracking the right metrics is fundamental for any business. Dental practices included, no exception.
Yeah, it reinforces that idea data-driven decisions aren't just for, tech giants.
Nope. It's core to managing any service effectively, especially ones we rely on daily.
So which specific metrics did he highlight for dental?
He mentioned a few crucial ones. First, the basic number of patients served.
Okay, baseline activity level. Got it.
Then, utilization. How effectively are the dentists, the treatment rooms, the resources being used?
Right. Efficiency of resources meeting patient needs.
And third, revenue per hour per chair.
That sounds like a key financial health indicator.
Seems like it. If a chair's empty, or a dentist has downtime. that hits the bottom line, right?
And impacts the clinic's ability to serve more patients, manage costs, which comes back to the patient experience again.
It all connects.
Those are vital metrics for sure.
Yeah.
Patient numbers for volume, utilization for efficiency, revenue per chair for productivity. Gives a pretty comprehensive picture.
And the whole point of tracking these, he said, is so the clinic can set achievable KPIs.
Key performance indicators for the staff.
Yeah, giving them clear goals so everyone knows what success looks like, what they're aiming for.
Makes sense. Clear, measurable goals drive performance, provides focus, lets you track progress, motivates people.
Towards outcomes that hopefully benefit the patient, too.
Ultimately, yes.
He gave a good example. Clinic staff just keeping an eye on patient numbers per week or month.
Simple metric.
But just having that awareness can motivate them, thinking proactively about attracting new patients.
Maybe follow-up calls, helpful reminders, things like that.
Exactly, things that improve the patient's interaction with the clinic anyway.
That's a perfect illustration. Tracking a number leads to positive action, contributes to growth, allows them to keep providing care.
Turns data from just figures into, well, actionable insights for the team.
Exactly right.
So ultimately, it really does come back to identifying those key actionable metrics, the ones that genuinely drive improvement.
You can get swamped by too much data, can't you?
Totally. Focusing on the right data makes all the difference for efficiency and for our experience as patients.
It's about zeroing in on the vital few, the ones giving the most meaningful insights to guide decisions.
Decisions that hopefully benefit us.
That's the goal.
Now, Kevin's interview was actually part of a series from a company called Medtrik.
Ah, right. So he mentioned them.
Naturally, yeah. He touched on what they offer. And what stood out was their emphasis on providing clear, actionable insights and metrics.
Which lines up perfectly with everything we've just discussed.
Exactly. And it's important to see why that's valuable, right? The focus isn't just raw data dumps.
No, it's about transforming data into something usable, something managers can understand easily and make informed decisions with.
Decisions that hopefully lead to a better patient experience down the line.
That should be the aim.
He talked about translating data, even triangulating it, pulling from different sources.
Yeah, to get a clearer, more complete picture, not just looking at one number in isolation.
So for us as patients, that means the clinic is looking at, what, appointment schedules, patient records, billing, all of it together.
Bringing data from various parts of the practice together, yes, gives a much more holistic view of what's influencing performance.
Compared to just looking at bits and pieces separately.
Allows for more targeted improvements, things that can benefit you directly as a patient.
And of course, AI comes into play here.
The buzzword. But relevant here.
Kevin mentioned how AI can sift through all that data, huge amounts.
Find patterns humans might miss.
Exactly. Identify trends and make the data more accessible, more actionable for the clinic.
To improve how they serve patients, yeah. AI can be a powerful tool for that. Taking loads of info, finding the important bits.
Giving clinics valuable insights for efficiency, for improving our experience.
Definite potential there.
But he also made a really important point, a crucial caveat maybe.
Oh, which is?
The effectiveness of AI is totally dependent on the data quality. Garbage in, garbage out, right?
That's fundamental. Data Science 101. If the underlying data is inaccurate, incomplete, messy.
Even the smartest AI isn't going to give you reliable insight.
Nope. Can't build good decisions on a shaky foundation. The insights won't be trustworthy for improving patient care.
That's why Medtrik, he said, puts a big emphasis on data integrity, making sure it's accurate, complete.
Which makes sense if you want to maximize what AI can actually do.
Gotta have that quality data first.
Absolutely vital. Ensures the insights are trustworthy, gives the clinic a solid base for decisions.
Decisions that should lead to better care, smoother experiences for us.
Fingers crossed.
So in a nutshell, Medtrik aims to help dental practices track and really understand those.
Monitor performance in real time.
And make smarter, data-driven decisions that should, in theory, lead to better service for patients.
It sounds like it's about offering a solution to bridge that gap, between just having data and having practical strategies for improvement.
Improving how the practice operates and how it serves patients like us.
That seems to me the idea.
Okay, so to wrap up this deep dive, based on our chat about Kevin Lee's insights,
what are the main takeaways?
we've really hit on a few key things, I think. First, the need for real business skills alongside the clinical ones in dentistry. It's essential.
Can't just be good at fillings. Got to understand the business too.
Right. Second, the huge impact of efficiency or inefficiency on everything. Costs, patient satisfaction, The lot.
It really ripples through the whole operation and patient experience.
Third, the value of clear communication and really engaging the team. Sometimes overlooked, maybe.
The soft skills that have a hard impact. Hugely important.
And finally, the absolutely vital role of good data, actionable metrics, driving positive change.
Creating a better experience for everyone involved, staff and patients.
And like we said at the start, these aren't just dental industry lessons, are they?
Not at all. Kevin's experience was dental, but the principles. Understanding numbers, optimizing operations, fostering a strong team.
Pretty universal stuff.
Yeah.
Applies to almost any business, or even just thinking about services we use.
How could they be improved? Yeah.
Absolutely. So thinking about this focus on data in the dental world, it makes you wonder, doesn't it? What other seemingly essential services that we rely on could really benefit from a similar deep focus on metrics and efficiency?
That's a great question. Where else could this thinking be applied?
And what kind of unexpected improvements might we see if they did in those other areas?
Definitely something interesting to ponder, applying that analytical lens more broadly.
Could uncover significant opportunities, couldn't it? For improvement, innovation, benefiting all of us.
A fantastic thought to leave people with.
And hey, if you found these insights valuable, this deep dive was actually based on issue 1 of Pearls of Wisdom.
Ah, so there's more where that came from.
Sounds like it. Plenty more to explore in future issues for those interested in digging even deeper.